Topping our health lead with welcome news. Overdose deaths in the United States plummeted by 27% from 2023 to 2024. That's according to new data from the Centers for Disease Control and Prevention. Now, the numbers are still too high. 80,000 is still too high, but still going down is a good sign. You might wonder how. How did this happen? Why is it going down? And how can the United States keep this trend going? Experts say it's likely several factors: a gradual decline in cities and states' use of opioids, a lower satisfaction with the illicit opioid supply, which forces many drug users to reach an inflection point, and many then, hopefully, decide to seek help. And that help is often funded by opioid settlement dollars and federal funding. Joining us now, Democratic Congresswoman Madeleine Dean from the great Commonwealth of Pennsylvania, also the chair of the bipartisan Fentanyl Prevention Caucus, and somebody with a personal experience with this we'll get to in the second question. But first, you questioned Health and Human Services Secretary RFK Jr. this week about the Trump administration's plans. At least it seemed like there were some plans being floated to make massive cuts to the Substance Abuse and Mental Health Services Administration. RFK Jr. told you no addiction centers would be shut down. He just wants to make it more efficient. Tell us more about that. Is that accurate, what he's saying?
Well, I don't think so, because if you take a look at the so-called skinny budget, it zeroes out program after program after program that has to do with addiction, mental health, substance use disorder, recovery, treatment, access, not to mention the Medicaid threatened cuts and how that will impact those who are addicted and seeking treatment. One of the things that's very troubling is with SAMHSA. They already fired 19 people who were doing data collection around overdose deaths and recovery. And so when you go in and you say, they actually have asked that they will eliminate SAMHSA and put it into something called AHA. I don't know what that is. We have MAHA, we have MAGA, now we have AHA. They're going to shift and shaft, as I see it, at a time when you just reported what is remarkably good news.
Yeah, it's working.
When you have a 27% decrease, just let's think of the numbers. I call it a jetliner a day. As a result of COVID, there was a great, sad spike in overdose deaths. 110,000 people a year dying. That's 300 people a day, 365 days a year. I call that a jetliner a day.
Yeah, that's vivid.
Last year, it was down to 220 people a day. Still horrifying.
Still
bad. And, really cratering families and communities. But when you have a 27% decrease, and we know some of the reasons for it, why in God's name would you shutter SAMHSA that is doing this good work?
So viewers of the show know, because I interviewed you and your son.
You did.
That this is a personal story to you. You co-wrote a book with Harry, your son, about his battle with substance abuse. It's called Under Our Roof, a son's battle for recovery, a mother's battle for her son. Honestly, no matter what you accomplish legislatively, this is an incredible legacy, what you're doing here.
That's awful
with
nice
your
of
son.
you to say.
I just think it's true.
That's nice of you to say.
You also talk about being lucky to have the financial means that you could help Harry.
Yeah.
A lot of people don't. Talk about that if you could.
A lot of people don't have access to recovery. I've met way too many parents, mothers, who have lost their sons, and their kids were hoping to get to treatment, and they're on phone call after phone call asking for help. We had the ability, pre-insurance, but now many insurance policies cover the beginnings of recovery, but not nearly enough. Every single child of God, every single American who is struggling with addiction, let's remember it's a disease.
Yeah.
It is not, it's some failing of the human being. Everybody should have the access that my son had. We had the ability to get him somewhere to save his life. And I will tell you, thank you for the kind interview you did with Harry. Harry is 12 and a half years in long-term recovery, and he's doing the work of helping others get to recovery.
Yeah, he's a good kid. What's this bag you got here? What is this? This emergency overdose kit.
I literally carry this with me in my pocketbook every day for a couple of reasons. One, you never know who you might run into, who might be struggling, who might have gotten a poisoning from fentanyl. You don't have to be an addict to die of fentanyl poisoning now.
No, in fact, your former colleague, Ted Deutsch, Democratic congressman from Florida, his nephew was taking like an herbal supplement that had fentanyl in it
that was
and
laced
died.
with fentanyl.
Yeah.
And that is now tainted in so many substances, cocaine, marijuana, you name it. I carry that. We have it in my office for a couple of reasons. To help if we were ever called upon, but much more, reduce the stigma, reduce the shame, and say, we can save a life. And if you can save a life, it's possible you'll get that person to the help they need.
All right, Congresswoman Madeleine Dean, such an important conversation. I think we've talked about this twice this week, and it still feels like it's not enough. We had Congresswoman Brittany Peterson come on, whose mom is a survivor of opioid addiction as well, having gotten
She's a leader in this caucus.
Is that right?
Yeah,
okay,
she's
cool.
terrific.
Well, keep up the great work. It's really, really important, and let's hope that these numbers keep going down.
And let's hope the administration does not cut SAMHSA at all.
So, Congresswoman Dean, thanks so much. Appreciate it. Coming up next, the new comments today from